The Ghana AIDS Commission has appealed for assistance from the private sector to meet its funding needs.
This, it says, will enable it to procure more test kits and antiretroviral drugs to manage the national response.
The Commission has organized a private sector roundtable discussion on resource mobilization for HIV and AIDS response in Accra.
According to the Director General of the Ghana AIDS Commission, Dr. Angela L. Adas, Ghana has achieved positive results in the management of HIV infection over the decade. There is a 30% reduction in annual AIDS deaths from 16,320 in 2010 to 10,074 in 2013. Despite efforts at containing the disease, some people continue to die from it. There is, however, a significant increase in demand for HIV prevention, treatment, care and support services. This has driven up the cost of implementation of the National Strategic Plan for HIV and AIDS. Director General of the Ghana AIDS Commission, Dr. Angela L. Adas, said more funds are required to keep up the pace of work. She said as a result of Ghana's low middle income status, donor support for the Commission to manage the national response has declined.
Then we have the challenge of the commodities, the test kits. The test kits are not sufficient even for the day-to-day testing. How much more moving into campaign mode? That is where we need your help. But as a country, and because of the endorsement of the 1990 targets by the African Union and by the UN in last June, and the UN last September, we are embarking on the first 90 campaign. If we're going to test 6 million people this year, those 1 million test kits is just a drop in the ocean.
Minister of State in charge of private sector development, Dr. Rashid Pelpo, said the overall involvement of the private sector in the national HIV response had been quite minimal relative to its capabilities.
The participation and contribution of the private sector in the Ghana's HIV response has been well documented. It is for this reason that the Ghana AIDS Commission works with and encourages enterprises to commit resources and develop appropriate workplace policies to prevent HIV in the workplace rather than wait until it assumes crisis proportions.
Representatives of the private sector pledged to support the initiative by the Commission to raise funds for its programs.